Covering every region of the state, 14 clinical surge facilities now stand ready in New Hampshire, bringing the total number of beds available to accommodate the coming COVID-19 surge to more than 5,200.
The goal is that to close the business today, we'll finish our 14th site up in Colebrook. Once that is complete, the goal's intent, as most people know, is to hopefully lock the door, close it, but if need be, we can turn that on and have that surge capacity available.
As the pandemic accelerates in New Hampshire, the need for beds will increase. The governor says it's not clear yet how long the COVID-19 peak could last, but he says it'll hit first in New York and Boston.
Their surge is estimated, let's say, third week in April. Our surge is more estimated at the very end of April to the first week in May, about 10 days after that. Now, how long that crest actually lasts, it's not just a single point and starts to go down, unfortunately. That crest could be weeks.
The state is also making its first emergency hospital loan. Lakes Region General Hospital will get a $5.25 million zero-interest loan from the taxpayers to ensure it remains open amid the pandemic.
Because of this loan, LRGH will only have to temporarily furlough some of its workers, about 40% in total, but will still be able to keep their benefits and access the state's expanded unemployment benefit programs. While we can't avoid all furloughs across the state, these grants will ensure that no doors are permanently closing.
And today, the governor also announced that the state will be moving its cash reserves, hundreds of millions of dollars, into locally owned New Hampshire banks. That's something the state used to do up until an economic downturn in the 90s. The governor said he's bringing the practice back to increase liquidity here in the local economy. Reporting live in Concord, Adam Sexton, WMUR News 9.